What was your biggest takeaway, or what were you most excited about your fluid biomarker presentation that you gave?
Uh, well, I think the exciting part was after we gave that presentation showing what biomarker we think are very relevant for progression. We had two or three talks after that showing the real application of those biomarkers and how they really reflected progression in different cohorts using different approaches. What I found also interesting that we started to see some biomarker panels that were based on discovery tools and how they can help us predict PIRA. We are still very early in this field, but I think we will see a lot more of those examples in the next years.
Mhm. In your experience, what misconceptions do clinicians hold about interpreting and applying fluid biomarker information in progressive MS, and how would you clarify these points?
I think one very important limitation that I see when we start using those biomarker in progressive MS, based on the data we have, even if we don't necessarily have an explanation for it, the meaningfulness of one biomarker is different in primary than secondary progressive MS. I think this is a key importance if you try to use NFL in secondary progressive MS, especially non-active secondary progressive MS, to predict progression. You are probably not going to see anything. While if you try to use NFL in primary progressive MS, NFL is highly predictive of progression in primary progressive MS. It's exactly the opposite when you use GFAP. So I think it's a limitation we have to keep in mind at what stage is our patient and is the biomarker we want to use the right biomarker for this stage.